In the silent chambers of your body lies a powerhouse. It's your liver. Yes, your liver. Working tirelessly, floating toxins, and storing energy, supporting life itself. But what happens when the liver is under an attack? Who knows?
Hepatitis affects hundreds of millions of people around the world, but yet many don't even know that they have it. But the good news is that hepatitis is preventable, treatable, and in many cases, even curable. So let's get started. First of all, what is hepatitis? Hepatitis is an inflammation of the liver. And the liver is a vital organ that actually processes nutrients and filters blood and also helps to fight infections in our body. But when this liver is inflamed or damaged, its functions can be really affected. So basically, the word hepatitis literally means inflammation of the liver. And it can actually be caused by different things, including like viruses, alcohol use, some medications, toxins, and also autoimmune diseases. But the most common cause globally is viral hepatitis. I want us to know that there are 5 main types of viral hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and also hepatitis E. And each of these is caused by a different virus, but we'll talk about this now. So we'll talk about hepatitis A first. And I want us to know that hepatitis A is spread through contaminated food or water. And it has various symptoms that are attached to it, like fever, fatigue, you feeling nauseous. And this hepatitis A usually can be short-term and doesn't really cause chronic liver damage. But the good thing is that there's a vaccine for hepatitis A. Now we have hepatitis B, short form HBV. And this can be spread through blood, sexual contact, or from mother to baby at birth. And I want to know that this can become a chronic infection, which can also lead to liver cirrhosis and also liver cancer. But there is a safe and effective vaccine to prevent this. And it's actually one of the leading causes of liver-related deaths worldwide. Now we have hepatitis C, which is HCV short form. And this is also spread mostly through blood, especially via shared needles or on-screen blood transfusions. But as at now, we have no vaccine yet for hepatitis C. But, the good news is that it can be cured from proper antiviral treatment. And it often goes undetected because people may not have symptoms of this for years. So it's an asymptomatic virus. Now we also have hepatitis D, short form HDV. Now this only occurs when people are actually or already infected with hepatitis B, and this makes the infection more severe. But hepatitis D can be preventable through hepatitis B vaccination. And lastly, we have the hepatitis E, short form HEV. This is kind of similar to hepatitis A and is spread through contaminated water. Now, this specific type of virus is usually resolved on its own, but it can be very serious in pregnant women. Now, we'll talk about how hepatitis spreads because you have to first know how it spreads and that to prevent yourself. Now, hepatitis A and E are usually spread through contaminated food and water. Poor sanitation, lack of clean drinking water, or improper food handling can cause an outbreak of hepatitis A and E. So I want you to think of it like a foodborne disease. You might not even know that you are ingesting the virus until symptoms start to show. Now, for hepatitis B, C, and D, these are mostly or mainly spread through blood and body fluids. And this also includes like unsafe injections or blood transfusions, sharing needles and syringes, unprotected sex from mother to child at birth, and also use of unsterilized instruments for tattoos, piercing, or even at your regular barber shop. Now, we might wonder or ask that is hepatitis communicable or non-communicable? And this is a very important question. Well, the answer is yes. Some forms of hepatitis are communicable while some are not. Hepatitis A, B, C, D, and E, they are all communicable diseases and they are spread from a person to another person. But this is through the method of various transmission. It can be either through contaminated food or water or through blood and body fluids. But however, I want us to note that non-viral hepatitis, such as hepatitis caused by alcohol, drugs, and autoimmune diseases, is not communicable. Now, I would love to talk about the things that we personally could do and the government could also do to help curb the spread of this infection. And number one is to strengthen the vaccination programs, especially for hepatitis B, because this is a very, very, very highly effective vaccine. And I want to know that every firstborn should receive the hepatitis B vaccine within 24 hours of birth. Another way we can also curb the spread of this infection is to ensure safe blood transfusion. So any blood that should be transfused from one person to another must be properly screened for hepatitis B and hepatitis C. There must be no shortcut to ensure that this virus is not spread from one person to another through blood. Now, another thing we could do to help prevent the spread of this is to promote safe injection practices. So our healthcare systems, they should ensure that all needles are properly sanitized, and a needle that has been used should never be reused, because this virus can spread from one person to another. One thing we can also do is to improve our sanitation and water safety, because this will help to curb the spread of hepatitis A and E. And we ourselves to ensure that our environment is always clean. So one thing we could also do is to spread more awareness to people around you. Let them know about hepatitis. Let them know that it can easily be spread from one person to another. And this will help to curb the spread of this infection.
Hepatitis is no respecter of man, crossing the borders of every country and also in our country, Nigeria. So, whether it's getting vaccinated or seeking help, always look for a way to stay out of this virus and keep yourself safe. This is Idea Television and I am Jacobs Deborah. And remember, stay informed, stay safe.